My name is Chris Kiefer.
And I'm Osman Kahia.
And today in this video, we're going to be demonstrating for you guys some Bougie Microskills. So when you're doing a surgical crank, it's really a two-person technique, much in the same way that quality bag valve masking is a two-person technique, okay? And the reason for that is you've got a lot going on here as the operator. Prepping a tube is certainly not part of that. You're going to lose your landmarking, you're going to lose your place, okay? So always in your airway plan, make sure you have that person who's going to be your assistant for you being the operator. So as my assistant, Osman is going to load that bougie, that ET tube onto the bougie before I've even really started, okay? And as you've seen here, he's moving the ETT quite high on the bougie. So if he passes it to me now, I've got a lot of room to work with. If he were to pass it to me with the ETT down here, it's getting caught on things. It's not going to pass well, okay? The other detail you notice is that the coude tip of the bougie is pointed caudad, okay? As opposed to being upside down and diving down here. If we go into the trachea this way, we're not going to advance. We're going to get stuck on tracheal rings and it's not going to move along. Okay, so very important that that coude tip is pointing towards the feet and back up towards the sky. Okay, so doing my 6-part motor pattern, I have stabilized the larynx, I have gotten my landmarking done, I've stabilized my forearm on the patient's sternum, I've made my cuts, my finger is into the cricothyroid membrane space, and I've dove that finger all the way to the back of the trachea, and I'm actually feeling the posterior aspect of the cricoid ring and the trachea itself, okay? And now I'm getting the bougie passed to me by Osman in the correct manner. And you're gonna see I've got some choices in terms of how I put this bougie in. If you think about your finger, you've got a lot of sensory information along the pad of the finger and a lot less on this hard thing, epithelial thing, keratinized thing we call a nail, right? And so we're always gonna pass the bougie along the pad of the finger and benefit from that sensory information, okay? And this feels a lot like doing a chest tube. Your finger is into a potential space there and you're able to get a lot of tactile feedback, okay? So passing the bougie along the pad of the finger and into the trachea is how we do this, okay? A couple fine details here. You guys come around here. My finger's in here. Sometimes if I've got a lot of tissue, it can be a bit of a challenge to get that bougie and my finger into the space at the same time, right? So what I can do is use my thumb and pinch the bougie and use the thumb to sort of feed the bougie along my pad. I can withdraw my finger slightly. I'm still in the trachea, but making space for my finger and the bougie. Okay, and once I felt the bougie is in, I can remove my thumb again, pass the bougie slightly. I can get Osman to actually twist the whole bougie back and forth, and I really feel that coude tip moving and gain a lot of confidence that I'm in the right space, and then I can continue to advance the bougie until hold up. Okay, I get the tube passed on down to me. Now when I pass the tube, I'm not gonna push from up here. I don't have a lot of control. I'm gonna push down close to where I'm at here. Osman's stabilizing the bougie, right? And I'm putting in the ETT. It's important not to go too deep here, obviously, right? If we're looking at where we'd be at the lips, 22 at the lips, we don't need to put this tube in very far. Okay, it's really just past the balloon. Cuff is up, we can remove the bougie, and we have successfully tracheally intubated our patient.